of the surface. So here is a movie on the time split. This is all the incisors for this video. It's in first group is 10 seconds needed. For the second, this is MSP. You need a little bit more, 14. Again, I work until enamel dentin junction on the old incisor. And this is with a high speed. You see, I'm going just to some marks I done on the lingual surface of the tooth. So I have already fixed field to prepare with a turbine and with a laser. So again, about the micro leakage. Surface modifications is always good to be performed before finishing the cavity, and ensures a good sealing and less micro leakage after. The thermocycling machine does 5,000 cycles. I think this is the set. These are the settings, you know, and it changes hot and cold water. Second conclusion is that I told you we have to lower the energy not more than 300 millijoules. Then you got enough bond strength without using the etching procedure, but I recommend it. And the high-speed drills showed really bad results, less than 30% without leakage. Now, second part of the assay, it's about the time split results. For this we used another teeth with larger cavities, 4 to 4, again until the enamel dentin junction. The operator on the digital stopwatch stopped on the command from me. We use the same three kinds of teeth, freshly erupted incisors. They are with the same kind of enamel like the old incisors, but the enamel is a little bit thicker, so we need more time to prepare this. But in premolars, the enamel is noticeably harder, so it really took more time to do preparation for the cavity of this size. So this is the chart. You see, for all the incisor average we need 10 seconds, like was in the movie. For freshly erupted we need 14 seconds. But if you remember, with the MSP we did it on the movie for 14 seconds, and here you see the average is around 12. So it was a little bit harder sample. These are the average speeds, average time, and with the high speed, for all the incisor you are 2 seconds slower, but for the premolar you are about 100% slower. So you will see the differences now in the next chart. This is another look of the, this is with the QSP, this with the turbine. You see there is no big difference in the old incisor, where the enamel is softer and the quantity of tissue to be removed is almost the same. But like in premolars, where the quantity is larger and the enamel is very hard, the turbine is very, very slow. It's more than 100% slower. It's 100, yeah. So there is a time difference between the different kind of teeth in the same mode. So in the 500 millijoule QSP mode, you see if you compare the freshly to the old incisors, there's around 40% slower, and MSP mode showed the less slowing because of maybe too high hertz rate, and the higher hertz rate compensates this average energy, because it's not high energy. 300 millijoules is a normal energy to use to remove the enamel. So this 300 millijoule works almost equal in different kinds of enamel. So the slowing is not so much like in this mode, because it's a lower hertz rate. But for the turbine, with the high speed, we have 50% slower from two different kinds of incisors, and when we compare to the premolars, we have almost 100% slowing the speed of preparation. And the comparison between different modes in same kind of teeth. So if you work on the freshly erupted incisor between 300 millijoule and 500 millijoule, you are only 4% slower with the 300. It compensates the hertz rate. So in softer enamel, when you don't have to remove a large amount of tissue, it's enough to work on 300 millijoules, and the speed, it depends only on the hertz rate. So it's very easy to increase the hertz rate because it's still safer. Okay. So when you compare MSP to 500 millijoule QSP, there is not big difference. There is not clinically noticeable slowing of the preparation, but QSP is more resource-consuming mode of the laser machine. So if you have to work more over the day, it's better to use MSP instead of QSP to keep your laser machine for a longer time, because in this most of the cases, these freshly erupted incisors are mostly equal to the human enamel. So it's equal. Effectivity of the QSP and MSP mode is almost equal. The differences are not so big, but compared to the turbine, you have 30%. No, turbine is here. I'll show you later. So in premolars, when you have a harder enamel, like in some human freshly erupted molars, it's almost the same. It's better to use QSP, especially this 500 millijoules mode, to work faster and quieter. So because with a 500 millijoules QSP, it's almost the same noise like with 300 millijoules MSP, but you are really faster. And if you compare the 500 millijoule to the high-speed drill, you see that you are 50% slower in the premolars and 40% in the freshly erupted incisors, which are closer to the human enamel. Do you have some questions about this chart, or we can go further?
Let's move ahead.
Move ahead because the time is going, I see. Conclusions: that is a proportional slowing of the preparation according to enamel hardness. So you cannot use it for a guide like a chart ready to use for your machine, because they are not human teeth, but there is a correlation, and I told you premolars like human molars and freshly erupted incisors like